Hi, I'm here for your weekly interview. We're going around and having some fantastic moments with local individuals who have impacted Frederick County quite a bit. And of course, this is Fair Housing Month, or we're rolling it out of it. And I'm here with Shannon Alshire, and she is with the Mental Health Association of Frederick County. And I'm just honored to be with you today, Shannon. We've been having a good conversation. You've been filling me in on the tremendous role that the Mental Health Association has here in Frederick and with the citizens. And we're here today because we just really want to be informed. We know that our Young Professionals Network and our community service committees have paired together to support the Mental Health Association of Frederick County in that you are celebrating your Catoctin Affair this weekend and next weekend, and it's a big deal. As a marvelous event. I've seen photographs of that and know that many people do participate in that. But they're meeting at Baker Park, and they're going to have a health walk, and we're trying to raise funds. And today we're going to talk about why you need funds and what do you do. So let's just start there. You've been sharing with me some of the things that it would be important for us to know how you impact the mental health of the citizens where we serve and live. What are some of the things that we should know about the things that you do?
Well, I think one of the most important things to start with is our mission, because when people hear our name, they think crisis intervention and counseling, and I like to say we do that, but we do a whole lot more. And so all of our work is to build a strong foundation of emotional wellness for the whole community. And we do that by preparing resilient children, securing vulnerable families, and standing with people to face crises together. And we have our mission kind of set up like that because starting with children is the most important thing. Because if we can prevent something, it's going to benefit the whole community rather than if we have to intervene later.
So something that you were telling me where COVID dramatically impacted children and their caregivers this year and how you stepped in to help. Would you tell me a little bit more about that?
Sure. We were talking about our childcare community and how initially they were shut down. All of the childcare providers were shut down. But then the realization came that there are a lot of essential workers, our frontline healthcare workers, our EMS, firefighters, police that still needed childcare. And so every childcare provider, and many of them are very small businesses, had to kind of pivot, reapply to open, have adequate supplies of PPE and not PPE, yeah, PPE, and cleaning supplies, which were extremely hard to get there at the beginning. And so we worked to help them through that, and then we also partnered with the county's Office of Economic Development to bring some funding to them to help alleviate some of those increases in expenses.
Yeah, most of us aren't even aware of what that was happening behind the scenes.
Right.
You have a hotline that is open 24/7.
Yes.
And that is there for anyone in any crisis, and you're ready to meet that. How has that been affected in 2020, 2021 in regards to the COVID crisis that we've been going through?
So our call volume has skyrocketed because people are seeking information. And the people who call our call center aren't just calling if they're in crisis, they're calling for resources. So we've been a resource at the beginning of this, how can I get tested? What are the hours of the testing sites? And then more recently, vaccines and how people can access vaccines. And all of the other calls that we were traditionally taking. So we have seen a significant increase in the number of calls that are coming in. Last year we answered close to 50,000 calls in our call center.
Wow.
And people can access that by dialing 211, which is an easy to remember number for folks who need to reach out for help.
211. Yeah, I'll remember that. You do more than that. And one of the things that, as we've been talking, that has impacted me is you have crisis center here every day, 7 days a week. And you were telling me how when somebody comes in, they leave with a plan. There
Yes.
are crisis counselors here for everybody. Give me your perspective on that when they come here.
So it's amazing how much someone's disposition can improve just by feeling heard and having somebody kind of sort out the puzzle pieces and help them put them together. And that's what the plan is all about. So, Rebecca, our development person, just shared with us this morning a Google review that came in about somebody that brought their 12-year-old child here and how much better she felt when she left just 2 hours later. And so, feeling heard and understood is really important.
Knowing there are options.
Absolutely.
Yeah, that don't have to be stuck.
Right.
It's a scary feeling.
And the fact that, the service is provided at no charge to the people coming in. And so, that's not a barrier to somebody receiving help.
So anyone could stop in.
Right.
And some of your services are on a sliding scale.
Yes. Our counseling is on a sliding scale. So we again want to make sure that, we're at least removing that barrier to receiving services.
That's fantastic. And one of the things, because we are here today talking about our event, is that not all of your funding can come from government sources.
Right. There are definitely gaps. We do receive some grants and funding from the government, but a lot of that is year to year, and we can't really plan. So our fundraisers and our donors are especially important to us to help fill those gaps.
Absolutely. So here on this screen today in our video, we're going to put an easy button where people can actually donate for our event on Saturday, May 8th. And I just want to end with this because we have been focusing as an association on affordable housing as well. So homelessness is a part of that issue. Talk to me about how homelessness and mental health are paired together often.
I think it's great that your Fair Housing Month just rolls into Mental Health Awareness Month. There's definitely some synergies there. But the homeless population, housing and shelter is a basic need. It's what everything else is built upon. And so if that is unstable or non-existent, then people are going to have other contributing factors that are not good for their mental health. And we also know that a significant number of people who are experiencing homelessness also have a mental illness or a substance use problem. And so, there's definitely connection there between people who are struggling with housing and their mental well-being.
And right now, housing affordability is going way high.
Yes.
And we're very concerned about that. And so we do have some initiatives we're working on that. So thank you so much, Shannon. This is really broadening me. And so May is Mental Health Month.
Yes.
That's important. It starts out with your huge Catoctin Fair event. And we are going to be having our own walkathon in Baker Park on May 8th at 8 o'clock. Everyone's supposed to gather, I understand, between the Tally Center and the pavilion.
The gazebo,
The gazebo. But we're looking forward to seeing everybody there. And there's going to be a easy button here on this screen so that you can donate funds for a very, very worthy cause. Thank you very much.
Thank you, Terry.
Thank you.